currently, our two public health main goal. The first goal that we are working on is to push back or to delay the entry of the UK variant in Montreal. And the other one, as I said, is while we are trying to delay the entry or the predominance of the variant as the virus that is circulating, we have to vaccinate as soon as possible the most vulnerable population. And we know that the main factor is still age for hospitalization or deaths of COVID-19. To delay the entry of the variants, we have a different strategy, one that implies the public health work. So the good news is, as we're speaking at the beginning of this week, all the positive tests in Montreal are, as we know, criblés. So they are going in a special test in the laboratory to see if it is a presumptive case of a variant. As we are speaking, we estimate that we have around 8 to 10% of all of our new cases that are UK variant in Montreal, and we are managing 22 outbreaks linked to those variants, mainly in school and daycare center. The second strategy to delay the entry of the variants is maintaining as a population the public health measure in place. And I want to say thanks to the Montreal population, because we see that the measures that were put in place in January are still well applied. We see knowing with some indicators of our reproductive rates of the virus that is still below 1, and also we have a different census that tells us that people still limit and respect the public health measures. So we have to, if we still maintain those measures, and we've seen it in European countries where the variant is there, if the measures are well applied by the population, it is possible to reduce the reproductive rate of this variant.